Welcome to the fascinating world of endocrinology. Today, we are going to explore the pituitary gland, which acts as the master control room of your entire body. Imagine a massive, complex factory where one tiny department sends out specific instructions to keep everything running smoothly. When this control room works perfectly, your biological systems are in perfect harmony. But what happens when it sends too many instructions, or suddenly stops sending them altogether? The entire factory falls into absolute chaos. In this lecture, we will uncover exactly how these delicate hormonal balances are disrupted and how we can use simple mathematical tools to diagnose these invisible, life-altering conditions. Now that we understand the premise of our factory, let us look at the control room itself. The pituitary gland is a tiny, pea-sized structure sitting safely at the base of the brain. Despite its small size, it is incredibly powerful. It regulates major systems, including the thyroid, the adrenal glands, the gonads, and your overall physical growth. You might wonder why we spend so much time studying this tiny gland in medical science. The reality is that pituitary disorders have profound, life-altering impacts on patients. They affect everything from a person's physical appearance to their ability to survive daily stress. Understanding this gland is the first step to preventing completely avoidable complications. Building on our understanding of the gland's importance, let us examine what goes wrong. Pituitary gland disorders are broadly classified into two main categories based on hormone output. The first is hypersecretion, which means producing too much hormone. Most commonly, this is caused by benign tumors called pituitary adenomas. These tumors autonomously pump out hormones without listening to the body's natural stop signals. On the other hand, we have hyposecretion, which means producing too little hormone. This dangerous drop in essential hormones usually results from physical damage, radiation, or compression of the gland. Both extremes severely disrupt the delicate balance of our body's hormones, leading to widespread systemic issues. Having defined the two main types of secretion issues, let us see how they manifest physically, specifically with growth hormone. If a child experiences a deficiency in growth hormone, or hyposecretion, they will not reach their normal adult height. This leads to a condition known as pituitary dwarfism. Conversely, an excess of this hormone, or hypersecretion, causes a condition in adults called acromegaly. In acromegaly, the bones in the face, hands, and feet grow abnormally large, which often leads to severe cardiovascular issues. Without a deep understanding of these specific disorders, we would be completely unable to diagnose or treat these debilitating conditions, leaving patients to suffer. Knowing the severe consequences of growth hormone disorders, how do we actually detect them early? To diagnose conditions like pituitary dwarfism or giantism, doctors do not just look at a child once. Instead, they track their growth over time using a specific mathematical metric called growth velocity. This metric measures the rate of change in a person's height over a specific time interval. By comparing a patient's growth velocity to standardized pediatric growth charts, an endocrinologist can immediately spot if the anterior pituitary gland is failing to secrete enough growth hormone. This mathematical approach turns an invisible hormonal issue into a clear, measurable clinical sign. This brings us to the mathematical representation of this concept, which is beautifully simple yet incredibly powerful in clinical practice. The formula for growth velocity is h2 minus h1 divided by t2 minus t1. Let us break down these symbols. GV represents the growth velocity, typically measured in centimeters per year. H2 stands for the patient's final height at the end of the observation, while H1 represents their initial height. The variables T2 and T1 represent the ending and starting times in years. If the difference between the heights is very small over time, the growth velocity decreases, strongly suggesting a hyposecretion disorder, like pituitary dwarfism. Before we move on, let us see this formula in action with a concrete clinical example. A concerned parent brings their 8-year-old child to your clinic. The child's height today is 115 centimeters, and exactly 2 years ago, it was 109 centimeters. We need to calculate the growth velocity to check for growth hormone deficiency. We substitute the final height of 115 and the initial height of 109 into our numerator. The time difference in the denominator is simply 2 years. Subtracting the heights gives a total growth of 6 centimeters. Dividing this by 2 years gives a final growth velocity of 3 centimeters per year. Since the normal range is 5 to 6 centimeters per year, this low value strongly indicates stunted growth and hyposecretion. Now that we have successfully diagnosed an anterior pituitary issue, let us shift our focus to the posterior pituitary gland. This part of the master control room has a very different job. It stores and releases antidiuretic hormone, which is also known as ADH or vasopressin. The primary function of ADH is to tell your kidneys to retain water and keep your body hydrated. When the posterior pituitary functions normally, your water balance is perfectly maintained. However, if this system fails, the consequences for the patient's hydration levels are immediate and severe, leading us to a very dangerous clinical condition. This dangerous condition we just mentioned is called central diabetes insipidus. When the posterior pituitary fails to release ADH, the kidneys completely lose their ability to retain water. As a result, patients with this disorder urinate massive volumes of dilute urine, sometimes up to 15 liters a day. Because they are losing so much pure water, they become severely dehydrated. This massive water loss concentrates the solutes in their blood, making the blood dangerously thick and salty. To diagnose this life-threatening dehydration, we need a way to measure exactly how concentrated the patient's blood has become. To quantify that severe dehydration, we use the estimated plasma osmolality formula. Conceptually, this formula adds up the major particles floating in the blood to find the total concentration. P-osm represents the estimated plasma osmolality in milliosmoles per kilogram. We take the sodium concentration and multiply it by 2 to account for its accompanying anions, like chloride. Then we add the blood glucose divided by 18 and the blood urea nitrogen, or BUN, divided by 2.8. These divisions simply convert standard laboratory units into standard osmolar units. If the posterior pituitary fails and water is lost, the sodium concentration increases rapidly, causing the total plasma osmolality to spike to dangerous levels. Let us apply this formula to a patient arriving at the emergency room, urinating 15 liters a day. Their lab results show a sodium level of 155, glucose of 90, and BUN of 14. We plug these values into our equation to determine the severity of their water loss. Multiplying the sodium by 2 gives us 310, dividing the glucose by 18 gives us 5, and dividing the BUN by 2.8 also gives us 5. Adding these together yields a final estimated plasma osmolality of 320 milliosmoles per kilogram. Since the normal upper limit is 295, this high value proves the patient is severely dehydrated, confirming central diabetes insipidus. Having calculated the effects of these disorders, let us visualize the system that controls them. On screen is a schematic diagram of the hypothalamic pituitary axis. At the top, you see the hypothalamus, which connects down through the pituitary stalk to the two lobes of the pituitary gland. Notice the distinct anterior and posterior sections. The arrows pointing downward represent the hormones traveling to their target organs. You can see pathways leading to the thyroid, the adrenal glands, and the bones. This diagram beautifully illustrates how a single disruption in this central hub cascades down to affect multiple major organs, reinforcing why this tiny gland is truly the master control room of the body. We have covered a lot of ground today, so let us review the most important ideas. First, pituitary gland disorders fundamentally disrupt the body's master control system, leading to widespread systemic issues. Second, whether it is an adenoma causing hypersecretion and gigantism or tissue destruction causing hyposecretion and dwarfism, the consequences are severe. Third, we learned that by using mathematical tools like growth velocity and plasma osmolality, we can accurately diagnose these invisible hormonal imbalances. You now have a solid understanding of how this incredible gland works and fails. Always remember that in endocrinology, maintaining the delicate balance of feedback loops is the ultimate key to human health and survival.